Welcome to Successful Engagements Part 2. This is specifically dealing with clinical interventions that have to do with for autism spectrum disorder. I'm Karen Bailey. I am a licensed professional counselor, and I have been working with the ASD population for almost 20 years. Christina Davis is my Vanna today, and she's like my partner in crime, as she's my in my department that is for those who have developmental disabilities, including intellectual disabilities and autism. So we are working today to help inform, help explain, and so that you can be in a better place to help the clients that you have. So this is what we're going to work on in this training today. Is going to be just having appropriate expectations for ASD, learning to interpret behaviors of those who have ASD, understanding emotional regulation and giving space, teaching consistency and predictability to then learn flexibility. And lastly, just recognizing the family system and how the family system affects ASD and ID issues. So when I started thinking about this training, the main thing that I thought of was being a person and being relatable. I don't really know how many clients I've had over the years. I've had probably the youngest has been 4, and the oldest has probably been in their 50s, possibly 60s. So I've had a different range of issues, different trauma, non-trauma, all kinds of different things going on. But what I recognize is that they're all people. And just as most of you who are in, those of you who are in the field of mental health services and, in a helping profession, is that the first step is to just enjoy the person you're with. And that may seem really simple, but often sometimes when we get caught up in our own need an agenda and having statistically finishing the things that need to get done and feeling like they're not moving fast enough, or wanting to perform the right way for someone, that's when we get stuck. That's when we get in trouble. And so that's why I want to just begin with looking at this issue of how do we be ourselves and learn to engage people as people and learn, because everybody that I've ever worked with, and even the ones I have right now, I'm learning from. And that's makes it super easy to just kind of go into it and then process what needs to happen. And just also then looking at that resistance and aggression is not personal. Recognizing that can feel like it should be personal, but recognizing that doing your best not to take it personally. And also then looking at the trust factors take time. So again, people don't, like with any other counseling, this is a process. This isn't like, let me just show you I got the answers. It's about a process of it coming together and people trusting and working together. So I'm going to show you a video, which I thought, and it's going to take me a second just to get it together. Oh no, maybe not yet. No, I think I did. I think it just missed me. Here we go. Make sure I get this sound on. So what was that like for you? I know I got a little tear in my eye, and I've seen this a few times already, because I feel like that's where my heart is that we want to celebrate those that are on the autism spectrum, not make them just like us, and that sort of thing. So I'm going to start with expectations. So just to give some historical information, is that initially much of therapy around autism had to do with changing behavior. ABA is the most popular, using repetitive, consistent techniques to change a child's behavior to become more suitable or pleasant. Therapy was focused in general to help an ASD person become more normal and fit into society. And you may know people who have gone through ABA and have had positive experiences and ones that weren't so positive, but the idea was really, how do we help them kind of like manage in the world, and to be more like everyone else. The emerging now is really is celebrating neurodiversity and learning to understand what the ASD individual needs and what their strengths are and what their behaviors and stemming mean. It's grasping that normal isn't everything, but understanding a person's struggle in order he or she can overcome them and overcome their goals. These are just kind of where we are going and how we want to work with people. So the goal is not to cure autism. This is not how do we get the 5-step plan to make someone not autistic, because that's not going to happen. And Chrissy and I have talked over the time that we've worked together of families that we just knew that was kind of their thing, that they wanted the person that we were working with to be cured. And we could tell that because it was like they wanted something intense, or they wanted something to be a certain way so that they would not act different than themselves. I should just say to be easier. So the focus here is not curing, but it's to bring stabilization and celebrating strengths. So Neuro-What? I want to give some definitions so that and maybe some clarity. And again, as I'm going through my presentation, please feel free to put if you have a question into the chat. If you have any, at some points I'm going to ask you for some questions. But if you have a question about what I'm sharing, please feel free to ask, and Christina will bring it up to me at certain times. So you're welcome to do that. With so using the word neurodiversity, so in neuro and all these different words. So let's say autism spectrum disorder is mainly a neurological disorder. Neurotypical refers to the population of most people. Neurodivergent refers to those who have a different neurological makeup. Neurodivergent is more than ASD, but that's what we're going to focus on today. Usually people include ADHD, but we're going to focus on this. This is important to me, just like that little video that I showed, the cartoon, is that there is a difference in the makeup in their neurological part of their brain. So sometimes we look at things, we say behaviors, we see the external part that we would want change, but recognizing that they have their system is just a little bit different of a system, then that isn't going to change, even if if they get their behaviors under check. And it's important to recognize that, because when people accept that, there's more of a willingness then to work with that individual the way they are, as opposed to trying to make them become something else, which actually can be very difficult for them. Behavior is communication. So the big significant part what we'll talk about in this training is going to be understanding how to communicate with those who are on the spectrum, but also to understand how to interpret behaviors. This is the way I learned as a younger clinician when I first started out working with those who had autism. My first experiences were with those who were in home counseling that I had that were oppositional, not unusual in that field, oppositional, but also they had oddities. There's a difference about them. And because of my exposure really through a friend of learning about Asperger's, that's how it really got started, that I started making those connections, got them into get a psychological, and that was the correct answer, that they really did have Asperger's, which is harder with anybody. We don't use that term anymore, but any high functioning autism is difficult sometimes to get diagnosed, because people can see them as as normal, and they're like, why is there a problem here? Why are you having a problem with this information? So when I began to work with it, I work with parents, using the word interpret helped me to explain to them, to families, so that they can respond in a way that's helpful for clients, for their family members, instead of being like disciplinaries and also maybe even traumatic towards them and shameful. So we're going to look and do some of our own. So this is where I need class participation. So I'm going to give you some pictures. This is the first one. And I'm going to ask you to put some things in the chat, and Christina's going to give me some answers. So I need I'll need your help with this. So I know you have seen this young lady, this little girl in your store sometime. You have seen children fall out on the ground in the grocery store, when you're at the park, in different places. So when you see her, what do you see? What is your first reaction? What do you think is people's normal reaction? Like most people, when they see that happen, what do they think? What do you think the parent's going through, if that was your you saw the parent with them? What are your thoughts? How would you interpret this? Christine, do we have any answers?
We do. The first one is, a lot of times we assume the parent told them no, or they couldn't have something like candy or toy. Then parent is probably overwhelmed and child is tired. She was told no. Parent may be embarrassed. The parent is frustrated and overwhelmed. One person said, my youngest son is on the spectrum, so I believe I've been there. And this is what we've got so far. Child is tired, overwhelmed, overstimulated. People perceive the child as a brat. Parent embarrassed. Child might be hungry. Another parent might be embarrassed. I think the child might be uncomfortable or unhappy.
I think I'd like to start here, because I think that people get it. I mean, everybody can relate to seeing this. And sometimes children are told no. But for for us, as we're being trained and being aware, is that, I know that I looked through those years when I was started in-home counseling, and I recognized, the judgment went out the window, because I just don't know what a family's going through, and I don't know that situation. And she could be hungry, like a lot of you said, hungry, everybody's tired, they've been out too long. It could be the overstimulation of the environment. It could be that there's too much going on, the noise, the lights. There could be a lot of things that, it's not our job to analyze it right then, but if we have compassion, it does change us. And for a parent, I think the first thing that working with, especially when I'm working with children, they're teaching the caregivers, how to be okay with the fact that your child struggles in public, because your job is to focus on them. Your job is to focus on what they need at that moment, and not worrying about what people, people who don't understand, maybe some don't want to understand, but they pass judgment. That's not our job. Our job is to focus on them, because then that all that does is increase your anxiety. If I'm worried about that, you're acting like that this is happening in front of me, then I'm thinking that everybody, like I'm a stage, and then that increases my anxiety, which increases the child's anxiety. So good job. Let's see. So here's the second one. So loud man screaming, or not, well, men don't scream, they're just loud. A loud man and swearing, not okay. So what do you see when you see that? How would you interpret his behaviors? And how do you think people interpret his behaviors? Christina?
We got a dad is overwhelmed in danger.
He's kind of a young guy, and and he's clean cut. But you think of some of our clients who struggle, who are adults, and big guys, people who could be look threatening, and we are more concerned, we are concerned for our safety sometimes, and we don't understand. And depending on a family member, I mean, depending on how, if he's by himself or if people were with him, how they help to calm him, it can easily be, it becomes something where, people like situations like this can cause somebody to, call the police. And yet it could be the fact that he's just distressed and doesn't understand how to manage what was just told to him, or he doesn't understand. He could also be exhausted and tired, and the stimulation could be too much. So part of it is recognizing that everybody who's aggressive isn't aggressive just because I like to be a bully. It's because you don't know how to manage what's going on inside them. Any other answer? Any other ones?
Yes, we got stressed. He looks frustrated. Most people would say he looks angry, but he could be overwhelmed and overstimulated. He is scaring someone, angry, lack of control. Outward hostility is always a mask for deep pain, whether they realize it or not. He doesn't know a better way to ask for help because this is what works for him to get people to pay attention. And that's what we got so far.
Some good stuff. Okay. So I like this little cartoon because it's a little different. But if you had an adult who was emotional and crying and you're just around them, it's not a client, but you're like someplace where this person is that way. What is when, and I've experienced people where they just continue to cry, like they're not able to be consoled. And they seem to be like unable to manage themselves or kind of calm down and kind of, move on, so to speak. What kind of things what if you saw somebody like that, if you were, again, it's not your client, that's a little different relationship, but you're in someplace, in a doctor's office, you're seeing someone respond this way. What is your normal interpretation? Is that one harder? Christina and I were having a conversation because this would be easier for me to handle sometimes than aggression. But for Christina, she was like, I'll take the aggression any day. So that's just that's great. It's our strengths. Sometimes, the tears and just like people being overwhelmed can be a lot. And knowing how to do it. Does anyone have any opinion? What do you think, Christina, when you see that interpretive? How would you interpret that behavior?
Normally you look at them and you think there's something, they're upset about something, they're sad about something. Also, they could be overwhelmed and overstimulated. But I'm also the one that shies away from the crying. So.
Well, and I think that's a good point. Is that so? She could be the same as the gentleman, in the sense of being overwhelmed. But sometimes people respond by being like this, and some people respond by crying. So just kind of recognizing that it's just a different response because that's how their body works. And then here's the last one, which is Christina's favorite. So just imagine she is being let out of the store with her parent. And what is your interpretation of that? What would you think or see is going on if she was angry and in this position? Seeing some.
Karen, we did get some more for the last one. It was could be hormones, and they said, I always say it's okay to cry here in my office. Humans are supposed to cry, like we're supposed to laugh. And then for this one, it was she didn't get something she wanted. Limits have just been set. The limits have just been set. She's overwhelmed, upset for being told no.
And again, with kids that, the defensiveness, that could be how she's managing. And in an ASD world, that could just, it could be that there's a lot going on, and that stimulation can still be an issue, because whether I'm crying or angry, it could be that I cannot handle what's going on and I don't know how to calm down. I don't know how to calm myself down. So how do you interpret behavior? So this is just a little activity. It's not it's not supposed to like change your life as much as give you eyes to see a little differently. One of my favorite stories, and when I think of it, it was a client I had a while back, and the way her mom would share a story, her mom would get angry with her because she wasn't getting ready fast enough to get ready for school. But then through therapy, as we started processing some of that, it really was that she was anxious to leave the house. And that as mom was more calm with her and helped her to kind of, and encouraging as opposed to get it together, then that's when my client started to change. Their relationship began to change because it wasn't so like butting heads all the time. And my client wasn't as afraid. So these are things, that's why I use the term interpret, because if you remember that word while you're doing counseling or interacting with people, and when they're telling you a story, it can kind of help you to move forward and kind of recognize, well, maybe I'm interpreting it based on a certain way I do things. And also that's how parents are. Parents do things based on what their parents did. And so if I acted that way, that child acted, then I would have been so beat or punished, or I would have been in my room and, I wouldn't have gotten my toy or whatever it is. And so we assume that kind of behavior with our, for our child, but they're not they're not the same as us. So we want to be respectful of that and recognize that maybe if there's something else going on, as opposed to just assuming that I should punish or I should do what my parents did to me. That's really how it is. We all come in with our parent, the parent that we came with, that we grew up with, and we have to learn that we have to do something different for them. And that takes parents a little bit of a change. We'll talk more about this later, but I think it takes a minute, because there is a sense of this is what's right. And if I don't do it this way, I'm a wimp, or I'm not doing things right, or you're spoiling the child, when it's none of that. It's really about recognizing that they're wired differently, and if it's not working, it's not working. Here's my thing I like to always say, said it many times. It is, and for an ASD person, it is quite true. It is easier to kick, scream, throw something at you than to say, I don't like this, I can't do this, I'm scared, I'm anxious. And that's part of, I think, the main thing of therapy. When I think of therapy in general, for those who are on the spectrum, I think of how they can learn to communicate so that they get their needs met, so they can get the emotions out, so that they can learn then, and those that love them can learn to engage them the correct way, instead of always needing to scream or needing to react, because it's way easier to throw something at you or to punch you than it is to actually say, why are we doing this? I don't understand. That's just really like hard. It's like the mouth gets shut off. And therapy can help to, how do we calm and actually get the words out so that people can connect together. Okay, so these are more detailed things that I've learned over the years. So I like to use the term, make the covert overt. So effective in communication when it comes to ASD, part of it really comes from understanding that the nonverbal cues that most of us understand are not very easy for them to get. So I like to joke about the idea like that most of you, I'm pretty sure, understand the term of like the look, like that your parents gave you. Some people in some cultures call it the evil eye, and some people called it, and some was just, but everybody's parent, your parent could say something, and they did, by not saying anything, but by giving the look, like, which usually meant knock it off, don't go any further, keep your mouth quiet, or something of the face. You just knew that, freeze, just kind of like, don't do it. And I sometimes that can be very offensive to parents when their ASD children do not have that memo. They don't respond, and it can look like they're being oppositional and just being a brat, when really they didn't get that memo to pay attention to the nonverbal cues of your parent. When they give you that scowled look, that means something, like that means stop. So when I say this is that making the covert overt means saying exactly what you need them to understand, not being offended if they didn't get your innuendos with your body language, because they're not going to get it. And it just takes a lot of trouble away when we are able to just to say, hey, when an adult is talking to you, you need to stop talking. You know, when this is what you do with grandma, you need to not do that. To me, you don't do that, and kind of be very specific. So, and also you need to be very literal and general, and they don't, because ASD does not, individuals typically do not generalize. And when I say generalize, what I mean is that if I say, if Christina is a, you know, I'm trying to correct Christina, and I say, Christina, you know, do not talk to mommy right now because you're with your loud voice when she's talking to you. She might get that and not do it anymore, but she might not generalize that to say it. She could, that should not be for, you know, grandma or auntie or like her teacher. So it's important to say what you really want her to get, what you'd want what a client would want to grasp, is that it is very specific. It is very, and that helps them. And it doesn't mean that, you know, we all get it wrong at times, but as you are using it specifically, then you will get it more clear, and they will that will be reinforced in their system, the particular thing you're trying to teach. And just watch the clients that you have, the people you interact with. How much do we expect them to grasp information that we're not saying? We're not using our mouth. We're just like giving a frown, or we're giving a scowl, and we're expecting them to understand, because, or even just turning away. They might just, for some of us, if we just turned away, you would think, oh, wow, Karen's mad at me. But for them, that's not, they would just think, oh, Karen turned. They wouldn't interpret that as a behavior. So those are very, very small innuendos, but the more that you understand those things, that can help you then to help clients and their families understand how to to be on the same page. So again, with the overt, making the covert overt is recognizing, like when you're in therapy, is you can be doing exercises for a client to understand a person, and understanding behaviors and what a nonverbal cue would be. So Christina, can you share for a minute what you've been doing with one of your clients as an intervention with that particular issue?
One of the interventions I use with my clients is I've found on the internet, and I don't have it pulled up right now, but I found on the internet, it's different faces that they can recognize. Even the easiest, like smiling is happy and frowning is sad. And then I've looked for different videos and clips of more kind of like being ignored. What does that mean? So that they can progress with their skills on that.
Thanks. So the idea is that, again, we begin to make interpretations. Sometimes we're wrong, you know, in our interpretations, even when, because I might just need to leave and I might just be turning around. But at the same time, those innuendos are things that they need to learn, and they can be taught. It's a repetitive, just like explaining when you saw a picture. That's why I mentioned the last thing here is just like going through videos and, you know, on YouTube or movies, and just to say, what is that person experiencing right now? What do you hear them saying, and what do you see them saying? Because, you know, you know, we all know, you know, it's like a classic thing people joke about women, where someone comes up to them and says, what's wrong? And they're like, I'm fine. Well, you know, I'm fine. And my facial expression is completely different. And then most people can understand that, well, that means, okay, what's really going on? But that's not that like goes woo over a person that has ASD's head. They hear you saying, I'm fine. They may not grasp that you're really upset. And usually that's a bit, you know, that's a whole nother subject in terms of that interaction, because that's usually something that needs to be worked on. Anyways, but that's a way to work with the behaviors of and to help them to kind of to learn, oh, this is what that means. Oh, this is what mom would mean, because they don't see it intuitively like we would. I'm taking a deep breath as I read deep breathing. So another issue, another thing, which I think all clients would benefit from, is understanding how their body is connected to their emotions. Typically, those who have ASD, it is harder for them to even grasp that they're angry or upset, or, you know, some things they might get a little bit of, but a lot of times it's just an overwhelming like feeling, like my husband likes to say, a train wreck, you know, and just a lot of emotions, and it's not real, they just don't feel good, but they don't know. So if you have a client and there's more of an overwhelming feeling, part of it is that they probably need to learn to like put vocabulary words and to break things down. So I like to start with, you know, deep breathing, because it kind of puts them in a calm place of recognizing what's going on. And this is something to do in therapy, and like in the session itself, and then teach them to practice this with other people, and to teach the family members to teach them how to do this, so that they can learn what's going on. So it can be that, where do you feel this emotion in your body? That sounds, again, I've used that with clients that aren't ASD, but I think that it's harder for them to grasp it. And you just want to keep helping them to understand how that, that's why I have the question also, where do you feel the pain? Sometimes it's not clear that I'm feeling emotion, and the emotion is in my gut, it's in my stomach. It just feels like I'm hurting. And sometimes it's okay just to use those words. And sometimes even using like a picture of a body, you know, and having a outline and saying, where do you feel it? Where do you feel the pain? Because sometimes, again, using the word, you know, head, you know, like the body parts might not be very clear to them. And sometimes it's easier to point than it is to say, oh, this is what, you know, my stomach is what gets all, it feels like this, or something like that. So, and what are you able to say about your feelings? What is happening? So, you know, we recognize in general that feelings happen, they're triggered for a reason. There's an emotion, it's an emotional response for a reason, but we're trying to show them, like, make that connection. And recognizing that they're telling you right now, but who's a safe person? Who's a person that you could talk to if you're not in session? If this happens and it just is a normal Thursday and you're struggling, what could you say? How can you, you know, who could you talk to about this when you're feeling that pain? Because if you explain it to them that they understand, when you feel that pain, most of the time it's probably your emotions. And so we're trying to connect those emotions to something maybe that's not okay with your situation, and so that you can express it and how you can get it out verbally in that way. So I want, again, engaging family members, caregivers, teachers to understand this. And it's repetitive. It's not like once you do it, you explain the magic key that somehow, whoo, they're just going to get it. It's a practice. It's a learning a new skill. So another area is just in terms of emotional regulation, which again is that understanding behavior and emotion. So recognizing how, when people act out, is there emotion that goes with it, and how do we do this? So this is just another way of looking at this, reframing the emotion, the behavior. Because again, if I start throwing things right now, what does that mean? You know, how do we interpret that? And if we can help them to recognize their behaviors, or in their family to recognize when they're doing this, it probably means that, you know, that they are hungry, or that they are overstimulated, or maybe they're just overwhelmed with something we don't necessarily know. And recognizing, how do we help them in that area? How do we help them to recognizing what's going on around them? That, you know what, I don't do really good in malls. I don't really do good in these situations. I like these kind of situations better. Or I do get anxious when I have an unknown thing ahead of me, and helping them to make those connections. But usually that happens more with kindness and compassion, and recognizing something that takes time. I mean, takes time for everybody. So you do this a lot with your clients. Do you have anything else to add?
No, the only thing, I just know that you're going to have to do it multiple times. Most of my clients, I do this at least once every session, or once every other session, because they need repetition constantly.
Okay. This is another real important thing. And we live in a very busy world. And in that busy world, sometimes we try to cram too much in, and that can affect all of us that way. But when it comes to someone who has ASD, the need for space is greater. So I like to say it almost like, I'm just making this up, but I think you get the point when I say it this way. If typically you do 8 things a day, a person with ASD may need to do 4 or 5. That they need some space, they need more times. They need space to get ready for transitions. Transitions are difficult for those who have autism. That's a pretty much like a cornerstone like symptom of ASD is having issues with transition. And usually it can be way worse when it's like not, it's like, woo, we got to go. Always have to keep moving. They need that time to transition and to recognize that they're doing something new. They need space to be by themselves. Sometimes that's really depressed. They can look like they're doing something else. And then that's really where we want to have an understanding of how to help them manage and kind of have some rest time, just to have some time to kind of like, I like to say, defrag the brain. Being with multiple people and have multiple activities, even if they love them, even if they're favorite things, is exhausting. Their neurological makeup makes it way more challenging because it takes way more to interpret their behaviors and keep themselves in a place of being checked, like where they feel like they're like okay in that way. Space can calm and help them to learn to reduce their anxiety. So it can be like, wow, I'm going to take a 20-minute break, or it can just be that we're in a meeting right now and this is great. This is overstimulating this place. So I'm going to go even in the restroom for a few minutes just to take a deep breath. Even that can make a difference in having a little space. That I need a little space to have my own, my own thoughts. And so time alone is essential. So these are just questions to ask families. These are questions to ask families of what is like helpful. Because these are things that often aren't talked about. These are things that are often like kind of not on the radar. And we're more focused on like what needs to change, what's wrong. And it's like, well, how does the flow of your life look? This is very important because it can be the make or break of situations. And sometimes some really great activities doesn't mean all of them have to be accomplished at the same time. It could be that for 3 months you do one thing and 3 months you do another thing. But too many activities is way more dangerous and more, it just becomes unproductive. And it causes way more stress than it's worth. And just, so we want to help them to recognize that. Okay. I don't know why it does that. Well, let's see. So I want to introduce you to Ella. Her site and YouTube is called Purple Ella. She is from the UK, and she learned that she has autism in her 40s, but she had because both of her children have been diagnosed. So sometimes I like for you to get a perspective from somebody who is an advocate, but also has walked through it herself. So here's some information from her. So Ella covered a lot of different information, and but mostly learning how things can be helpful. I know that Christine and I, we have talked about it with our clients that sometimes having something to do while they're talking to us, just not being like straight talking, but actually being able to have something to do, have an art project, like not so much that they're doing an art like for therapy reason, but mostly because they have something to do. And she mentioned the fidget, so I thought I would go right into that, is that, I'll put it up to the screen so you can see a little, I'm not sure what you're seeing actually. I have fidgets like this. If you had, when we were not virtual pre-COVID, I used to have like next to the chair that a client would sit in. I have like all kinds of different things that can be helpful. The blurriness, it's more tactile. It's a really nice little feeling to it. I have like these little boxes and things like that, because I feel like that makes a difference, a rock. So sometimes I encourage clients that they have, for their parents to just, make it a habit of having some of them in the car, if the car is an anxiety thing. I like things that they can put in their hand and that they could keep in their pocket, because that way it can be the sensory experience of having something with them. It can make a difference in how they can hold on to it. A long time ago, I had a client who, she loved to carry her her stuffed animal with her. And, that's not really effective. It doesn't look the same as a 15-year-old as it did when you were 5. So learning to carry smaller animals that were more like this, the size of this, so she could put them in her pocket, but was a sense of comfort. And it was something for her to focus on when she was anxious. And we actually have a client that I was actually impressed that he did this all on his own, but he found a fidget ring, and they're not really expensive. I saw it, I think it's on Etsy, and basically so that he could just twirl it when he felt anxious. And that was like a great way of working with them. So that reduces anxiety. It helps them to kind of focus. So again, what she was saying, and I was like, yes, that's right, Ella, that's what I say too, is watching that your words aren't too large. That's that's a good thing in general. Some of our clients are really smart, but sometimes the words can become more of the issue, like the focus, as opposed to like what you're actually trying to say. And then watch that you don't use long sentences or deep concepts, all like a run-on sentence. I have been known to be a run-on sentence, and I've had to really watch that I'm saying one thing and you just giving one concept at a time, just like she was saying. I have used this before with, I call it the finger. We're going to do 3 things to this morning. And what are the 3 things? And just repetitively using that kind of sometimes helps people to remember, especially with younger kids, to do that. But sometimes even with older ones, like, what do I do in the morning? These are the 5 things I do. It doesn't hurt. But also what she was saying, it's just so easy to talk and give a whole reasoning around things. But if you just say, get ready for school, put your shoes on, put your shoes on, put your shoes on. And that might sound like, oh, I'm being rude or something, but that's what parents need to understand, is that their ears will pick it up more if you're short and sweet. And recognizing that sometimes, because I am a run-on sentence and that we all can be a little too wordy, is to ask. Invite them to say, did you understand what I'm talking about? Can you repeat back to me what you think I want you to do right now? And that will help them to then you realize, because it's okay. But a lot of times those who have ASD want to fit in. They really want to fit in. And if we don't give them permission to say, did you get what I was saying? Because I was just talking a whole bunch. If you don't say that, they will be like, I got it. And they're going to act like they're so with you, but really they're not. And that's really where it's on us to ask and to feel like it's okay. That's our place. That's leading them well. Also, watch your cadence. So I like to say, watch and notice the communication. And I would say this is something you teach also to other, other adults or other people that are caring for this ASD individual, is does it command an answer and authority instead of inviting a person to share? It's almost like, why did you do that? Sounds different than what was going on there. how strong your words are, how much you feel like you need to get an answer is different than actually sharing so that person feels like it's going to be okay. Like, we're okay. I just need to help you out. Being loud, especially for somebody who has the ears are typically more sensitive, they hear that. It doesn't usually get a response of feeling safe or warm, being warm. Okay. So as we're moving on, before I move on to this one, I wanted to ask to see if there's any questions. I've gone over a lot of information. I just want to give a pause. And Ella shared a lot of things as well. Is there any questions about what was already shared? Okay. So moving on, just wanted to give you a moment if you had something on your mind. Interventions to encourage emotional regulation. So again, this is about how you are working. And again, you see that deep breathing. Sometimes, how good are you at deep breathing? How often do you, when you're in a session, you just kind of stop? That might sound like I gotta perform, that really challenges our desire to perform and do things well. But sometimes just being able to sit and be with someone can be very effective. Sometimes watching our cadence. Are my words rushed? Or am I quiet? Or am I in a pace that says, oh, let's relax? As opposed to, we didn't get this done before it's done. Now there's a time to be rushing if there's a fire or if there's there's a reason, and that. But if in general, if I'm more rushing with my clients and as parents, or as family members who are working with, helping their family member who has ASD, it's important to help them to slow down and to say it. And if they have trouble, it's our job to say, how do you physically, in teaching them really practical ways. And this is the fidgets, those things, there are ways to kind of relax. I love like statements, positive statements. It's going to be okay. I'm going to be okay. I'm going to have a good day. And them learning that and them repeating them. What does this day look like for you? It's going to be good. Yeah, you have a lot going on. You're going to be okay. And because because the brain begins to respond to that versus I'm a loser, and the anxiety that's there, that's the way we fight it, right? The positive statements. Recognizing, stemming, and encouraging and accepting it. So stemming is a way that, we'll talk about, we'll have a little more video about that in a little bit, but kind of recognizing that sometimes people will do things on the spectrum that maybe are uncomfortable at times, or I won't say neurotypical people don't typically do them. I'll just say it that way. And that includes like the head banging and, needing to, making different noises. There's a lot of different ways that people can stem that kind of helps them to get a release and help them to feel like feel better. And so processing with them that they're actually stemming this and explain and then maybe helping them to recognize how they are to move forward. That would be what I would encourage you to do, because it's not like shame on you. It should be like, well, how do we do it? It sounds like you're anxious. This is like how do we manage this? And again, time and space. Because all that really does make a difference when we have a space to calm. And that could just mean going out in the car for a moment and sitting down. If that means, there's too much stimulation. And, and often in classrooms, that's the one thing that I encourage people when they have if their children has ASD, is to ask for that there's a space. Because often people, when kids are screaming, like they're having an outburst, and people, like adults, just feel like it's really good to get in the child's face and to say, why is this? And adults too, let's be real. They feel like, what's wrong with you? And that's obviously the opposite of what they need. They need sometimes there is not they can't answer that because they're just they're struggling so much emotionally that there's no words, but giving them a moment where they can just say, have a space, and then it's okay. We're not shaming them because they're not in the corner because they're being bad. they're having a space. And when we teach those patterns to children and adults, that it's okay to have a space and say, oh, give me a minute. All right, now I can tell you this is what's going on. Or they can say something more and we can talk about it better. Then every time that happens, that repetitiveness encourages that good habit. Okay. Co-regulation reduces dysregulation. Acceptance and kindness helps someone move forward. So if you work with somebody, have a family member, know someone who has ASD, and anyone who's emotional, and you are there as a calming and an accepting for a person in their life, then you are a co-regulator. You are there, and teaching family members how to do that and to be supportive, that person feels accepted and cared for, has more power than I think we realize. It has that connection, that sense that I feel safe with that person, actually makes someone be able to take risks and move forward, or recognize things quicker than if they had to rely on themselves. And eventually they won't need it as much. I'm just like a child, like a little toddler. At some point, they cry about everything, when they're babies if something doesn't go right. But then eventually they don't really need to. They recognize, oh, I can solve this problem, certain problems. And that's the same way, but when there's a need when there's a lot of dysregulation, it's our job to co-regulate. So further on communication, because it really is the biggest thing, is I like to call them my now people. Those who are on the spectrum are my now people, because the way they're made is that they really are focused on the present. So, if you have had a client and you're a counselor and you've had a client, and especially if it's a child, because parents feel like it's your job, like you're the probation officer, and that, Johnny did this last week. Now, sometimes and Johnny is like, that was so last week, why are you bringing this up? And that can sound like, well, you're just being, resistant. Well, sometimes people are resistant, but at the same time, they really are focused on the present. They really are in the moment, and they're really like, that has not in their current thoughts. So bringing something up like that's old, unless it's like something that you're working on today, it doesn't always compute with them. And it's really no reason to argue about that. It's more of kind of helping parents to know how to talk to their loved one and manage how do they in the moment, and then learning to let go of it, because bringing up all of that, the past and saying, well, you did this last week and then you did it today, that's like, doesn't make it, it's like, why are you bringing that up? They don't get it, and they could also cause them to be more upset, but it's not because they're just trying to evade something. They just don't really, they're like people in the now moment, they're present people. So it's really more important, and that's why I am very much into teaching other people, the family that is involved. Even my adult clients, I typically have some connection to the parent, to those they're close to, because I see them, once a week. How much influence, how much power do I have in their life compared to teaching the parents or caregivers and showing them how to manage the situation better, or how to see it better. So I always want them to be involved on some level. Of course, when they're older, things, it's different than when they're 5, but I still like them involved because they have the most power to change and really understand what their loved one is going through. Yes, blossoming through predictability. So something about ASD is that they thrive in predictability. That's why typically those who are on the spectrum, it can be really different at school for them. And they do well when they know what's going to happen. So their anxiety goes up when they can't predict what's going on. And that anxiety can also equal having poor behaviors. So I really encourage a consistent schedule. Like that brings emotional stability. When I can predict that I'm going to be doing these things, I can look at something. I really encourage having a calendar. I know that it's kind of more old fashioned to have like a paper calendar at, and because we can do everything electronically, but I think that even for young children, seeing something that says we're doing this and this today, or what the schedule is like, or when we're going to be doing things, is very helpful to say, to kind of reduce anxiety. If I'm leaving the house and I know what's going to happen, routines help them to move forward, to like, no, I'm going to be doing this next. Now, and then when it comes to communicating what's going on when we leave. So everybody, goes on, has times where they go on errands. So if you have if an ASD person is with them, whether it's a child or an adult, and sometimes, especially with kids, we just feel like I'm taking you with me. And, I don't have to tell you, I'm the parent. I'm not going to I'll have to tell you everything we're going to do. But, yeah, and that's how I grew up. I mean, I don't remember my parents giving me a list of where we were going to go. But for them, it serves them to have that to have some understanding of what they're going to be doing. It reduces their anxiety so that they can predict, oh, we're going to go to the bank, to laundry, over to get the dry cleaners and to get some gas, and we're going to go to Walmart. So it's good that helps them to know, oh, when these things are done, most likely we'll be home. It helps them to kind of process like how to anticipate what's next in the thing. And I also suggest that, I mean, this is my example when it comes to Walmart. I say when you go into the store, because sometimes, again, it can be like, we're just going to run in here. Well, Walmart, if I'm with you, and I might want to know what you're going to get in Walmart, because Walmart is, well, you could be getting stuff for your car, or you could be getting a rotisserie chicken. I mean, or both. And so, like, I think it's very helpful that when you're with someone who has ASD, to say to them, hey, we're going into the store, we're going to Walmart, and I need to pick up some, remember, we want to get your snacks, and I'm going to get some groceries, but I'm also going to pick up some of the art supplies we need for your project and whatever else. So when they know that, and they get used to that, then they predict, oh, we're going to get some things over there. They're thinking of, oh, I need to get my snack because that was something that was presented to them and they know they need it, and these other things, because that helps them they participate more. It reduces their anxiety because they're like involved. They're involved in the process as opposed to being shuffling around and because it's just overwhelming. I think in general, it just helps them to kind of feel like they're a part of it, and it can be successful. Those are things that I have experienced, as well as it's really helped to bring success and reduce that anxiety, because anxiety is probably the primary emotion that they feel, because they cannot anticipate the future. They cannot anticipate the social interaction I'm going to have with you. They can't anticipate the things that are the future, so to speak. So of course I've had parents that would say to me, but life is not predictable. Things happen. That's just the way life is. Why would crises happen? And I would just say, I think it's the next one. It's, I guess it's not. Sorry, thought I was being all cute. Anyways, but what it really does is that you're creating a predictable life that can then be learned to be flexible. Flexibility comes after predictability. So if there's chaos and everything's all over the place, there needs to be some stability, and then we learn flexibility. And that's what happened. I had one client that was an issue, and it was actually a parent that actually said that to me. How do you, this is a crisis, or that's not. She just has to be prepared for the real world. And then but at times but then she did learn. But then she did learn that she wasn't going to die when I had to change the appointment time. Like she was in the beginning, though, it was like a contract. And one time I couldn't make the appointment because like I hurt my leg and I couldn't drive. It was like, she was like, but Karen said she was going to be here. That's the facts. And she, and it's like her mom was embarrassed, but I just said, well, that's because she's needing that predictability. I didn't take it personally. I just said, yeah, that's where she's at, but she's going to be okay. And that's what you have to tell them. You're going to be okay when things go wrong. But it's easier to do that than if everything is like this and all unpredictable, so to speak. So let's see. So here's Miss Ella again. I think that this is I liked her example of an understanding of stemming, and I thought this, again, from her perspective is helpful. So let's hope that you enjoyed that. I like her because she just was able to explain her story and how those issues that, and sometimes I would, when she was saying some of those things, I'm thinking, I like to do that too. I mean, like when she's talking about the touching of thing, like the plants and stuff like that, that texture. I mean, it's kind of recognizing that sometimes having something there, and that is why I recommended having the fidgets or having something that there's something tactilely that can kind of help somebody's focus or reduce their stress. So now we're moving on to the last leg of my training, which is about the family and ASD. So I would say I came to Western Tidewater with a lot of information on autism and really had worked with autism for a while. But coming here is where I, really was challenged and grew in learning how to look at the family system and as a part of the ASD issue and how to help them. I think so often with ASD, we're focusing on the things that we've just talked about, the behaviors, the specifics of the situation that need to be, maybe we like differences or we want to help somebody process through something, but it's very important for us to look at how the family system affects the ASD. And what I mean is, is really that every family has a way of coping and how they manage in healthy and unhealthy ways. So autism is a challenge for every family, but looking at the system is the way that will show how the family is managing or using ASD to fit into the family's narrative. So part of that is you are watching and observing. Families will often focus on ASD or another disorder in order that they don't have to address their own individual issues, trauma, or unhealthy tendencies. So I've worked with a lot of families over the years, and some families, like having autism is like, yeah, it's still a chore. I mean, there are certain things that need to be done, and it is a lot of work, but it's kind of just a part of their way of life, and they just they've learned to work through it, and it's a process, and it's just not a big deal in the sense of like it's not a crisis. Whereas other families, it is a trauma. It's like their identity becomes what that person is going through. When a family is struggling with a ASD family member or any other diagnosis, ask yourself how the family is benefiting by focusing on that person versus the other significant issues in their family. Often when there isn't progress, it's really because at times families will sabotage a person's progress because success will throw off their unhealthy family system. This is really significant in to kind of looking at things and how we can be strategic when we're talking to families. And how we're helping them, because if they're not taking care of themselves, and if we're not aware of that, if we're blind to it, we're just focused on what the ASD person needs to be, what they need, then we will not be aware at all of the other pieces that really encourage the dynamics to be the way they are. And along with that, and continuing with that, I should say, is really that no one lives. Obviously, nobody lives in a vacuum with ASD. In the best of families, even and when families really have the best intentions, they all come with, we all come with baggage. And so it's important, this is where using a genogram, recognizing like family historical issues of how we handle stress and crisis and trauma can help recognize like why this is becoming an issue right now, or how we, where there have been unfaulty issues. Teaching parents to recognize their own trauma issues and their own triggers, and that making their own need for therapy, their own need for self-care as a priority can really change the function of the family. I had meant one of the families I had mentioned earlier, a child And where there was anger, and her mom would get angry at her because she wasn't, getting ready for school. Well, when I got to know this mom better, is that she had a trauma history in her childhood, and her father was very angry. And so because of that, her response, she had a lot of unresolved issues. And so when her daughter would say, who would not obey and do what she was being asked to do, it would just trigger all this more anger in her. And instead of really helping her daughter through it. So therapy with his family was about helping mom process her own stuff so that she could realize that that was her stuff and had little to do with this didn't have to do with her daughter right now. And she recognized that she resented that her daughter didn't obey her like her parents did, like how she had to do for her own parents. And so that's how all of our families come with stuff. All of our families come with, even in the most healthy, they all come with stuff. We're all individuals. And when we recognize some of them are really great strengths and some of them are things that we need to tweak that have less to do about the individual and more about how the family handles problems and crisis and and change. And that can be important. And so it's important to kind of to see that as a significant part of your trauma, your therapy, working with someone with ASD. Now, some people are resistant to this because they really want to focus on the client or our client, as the problem or as the issue. And whenever you see that a little too much, like it is that person's issue, and if that person would get it together, then typically that's the red flag of that there's probably something else going on in the family, that they would rather just be way angry at that person or say they would just get it together, or if this stress wasn't in my life, just because they're trying to avoid something else. And that's important to recognize. Like all grown up, and what do I do? So I think future training suggestion that I'm thinking of is to do something about working with those who are autistic that are adults, because there is so much information about children, and it's almost like we act like they're not going to grow up, but obviously they do, and how we help them through that. So part of the things that we have recognized is kind of how do we help a person like become an adult as much as, how do they become adult with this disability? As you learn from Purple Olive, she's married, she has kids, she has autism. It's not like it's, everybody is, some people are limited and need more help and some people aren't. But really the challenge is to help them to deal with the issues of dependence and disability, and help them to see where they can step out into their dreams and individuate and differentiate. Where is that possible? Where do they need support? They will need some need more support than others in life management skills, but it's also helping them to also learn to be respected. So respecting choices as an adult, things that you would, that I did with my parents when I was a child, and my parents just, said, we're going to go here, versus when I was, when I was an adult, we made choices together. And sometimes it's just easier to have a child be 10 years old, old enough that they're not, they have some mastery, but that they're really like, we have a handle on it, but that's not how people work. We don't stay at a certain age. And so it's really important to help parents to understand where they are overly protective, overly trying to like keep their kids from doing things that are, that the kids want to do, or that are, that they want to master. And yet the parents are afraid because they're going to get, something could happen to them. But it's processing some of those issues, because sometimes it just takes a minute for them to realize, yeah, but let them take this step here. It's better for them to take them safe when they're still, especially if they are like, older adolescents, it's better to do that now than it is when they're older. But even as an adult, how do we help them to take the steps that are appropriate, and where do we help them? So that's really important, and that can be a lifelong process of helping them. So one of the last questions I want to ask is, has your client been placed on the DD waivers list. So if you have a client that has ASD, I know I'm just putting that out there because this is a thing. And so often my clients that are, especially if they're higher functioning, this is not as often as like overlooked. This is not really about today and and what they need right now. But if some of our clients, they probably need some support when they're adults. This is going to be available to them if they did, as they get older and if they need some extra support. So in your local CSBs, there is a way to get screened for the DD waiver, and so that they would have that as available. And it's really not based on the parent's income, it's based on the person's income, even if they're a child. The waiver means that kind of stuff is waived. So obviously it's a little more complicated than that, but at the same time, I'm putting that bug in your ear to think about that. If you have clients and you don't typically think about the waiver, is to kind of look it up, and it is available. It is, again, I'm not really thinking of it as something for today. It's something for their future, so that they would have the extra supports. And I just think it's important to kind of not forget about that when you're working with, even if they're high functioning, because you just never know. Even just they could need adaptive equipment, or there could be a lot of different issues. So anyways, that's why I wanted to put that out there. So here we are, we're at the end. So I hope that was helpful for you. I hope you came away learning something and being as happy as this little boy is. But I want to ask you, I am going to continue to do these trainings, but at the same time, I don't want to do them for whatever I'm just thinking of. Please put in the chat ideas that are helpful. What was helpful about this training? What you would like more of? If there's something I touched on, but you would like more information about that, or because these are the ways I get ideas. This isn't really so I can just talk. It's so that I can give you some information that will actually make your job more effective, that you feel like you have more confidence with working with this population, because this is I used the word emerging earlier about neurodivergence, but that's where we're going. This is not something, I think maybe autism was seen as a small population many years ago, but this is like a significant part of our population, and that we want to be celebrating them and making them have the best lives that they can have. So thank you very much.